Okay, so here we go. Half the world, the many faces of social protection. I welcome everyone to this special event that is part of the high-level political forum that is happening in virtual format this week in New York and across the world. And as the head of UNDP, the United Nations Development Programme, it's my special pleasure to welcome you to this 1 hour of exploring a topic that literally is a matter of survival, or certainly at least the ability to maintain livelihoods for half of the world. That is a lot of people. And often, unfortunately, it is the people who fall through statistical gaps, who are not visible, who are often left behind, and who may not have the political voice to be seen or to be heard. And it is in our common interest to try and better understand how it is that we can both get a better feel and also understanding of who they are, where they live, and what it is that they are experiencing right now in this COVID-19 crisis in order to be able to move forward. We have simultaneous interpretation today in 3 languages, French, Spanish, and Russian. If you wish to listen to the event in any of these languages, please simply click on the link in the toolbar that says Languages and select the desired language. Over the next hour, with our special guests and partners, we will explore the many faces of social protection in COVID-19 times. To consider urgent action today and provide some food for thought on what the future of development could look like if everyone had a social safety net. Nets that today are either tattered or absent for over half of the people of the world, according to our partners and our sister agency in the International Labour Organization. It is my pleasure to be your moderator for the next hour. And just to repeat, for those of you who are joining, my name is Achim Steiner. I head the United Nations Development Programme. Before I introduce our panel and our first guest, let me share 3 reasons why UNDP is calling on countries to step up social protection today. First, because despite growing COVID-19 exhaustion, we have not flattened the global curve. Indeed, for many people, this pandemic is only getting started, and for some it is even getting worse again. It took nearly 3 months for the world to reach the 1 million mark for new COVID-19 cases. We are now at almost 13 million, adding over 1 million new cases every week for the foreseeable future. This is the kind of nightmare scenario that futurologists were playing with even just a few years ago, and the scenarios have left us awfully unprepared. This health crisis that is rapidly turning and has turned into a development crisis is spreading through some of the most densely populating developing countries in the world now, including Brazil, Mexico, India, Pakistan, Iran, South Africa.
Mexico,
We have
India,
yet to see the depth of the scars it will create. Some people are becoming inured to poverty, hunger, and jobs figures that keep getting worse. Statistics can numb us, but we cannot afford that. We cannot sleepwalk into a new normal. Unprecedented action is needed, and it is needed now. A second reason for this event is because the scale of action necessary to counter the social and economic impacts of the pandemic are unparalleled. Since March, 195 countries have topped up or extended their existing social assistance, cash transfer, or social insurance programs. Governments in the developing world have repurposed between 1% and 3% of their GDP in record time, something that seemed impossible just 6 months ago. But this is nowhere near the scope of what the richest economies are repurposing, surpassing 11% of global GDP at present. And the third reason is because unless we bring fresh perspectives and ideas to the table, successful action will depend on an uneven patchwork of social assistance, social insurance, and systems of care around the world. Many different groups of people benefit from social assistance and insurance programs, and many get left out. Rural households are not included in standard registries, migrants, or people who are displaced. Workers in the informal sector earn low wages, have little savings, and have little to or no access to social protection. The pandemic is expected to trigger a 60% decline in earnings of informal workers, according to our sister agency, ILO, and you will hear from their Director General, Guy Ryder, in a moment. Social protection has multiple dimensions, from cash to supplements, income to in-kind assistance that supplements nutrition, to care systems geared towards working women. And the challenges faced by middle-income countries, fragile country contexts, least developed countries, or small island developing states, they're all distinct and unique. Indeed, it is one of the ironies of this pandemic that there are countries, such as small island developing states, that may have none or very few cases, and therefore don't have a health crisis, but are feeling the full force of the social and economic impacts of a global pandemic. To them, tourism dependent, very often what is happening right now means that from one day to another, they have no economy. As we have learned from the first 3 months of assessments and context matters. This level of complexity cannot be addressed with a single social protection policy instrument. There are no silver bullets. Instead, a network of programs that interact with labor markets, population movement, and demographics is needed. Half of the world with inadequate access to social protection. This is the size of our challenge. Before we get started, dear participants and dear panelists, I'd like to recap the run of show briefly and share some housekeeping issues for the next 50 or so minutes. We will have 3 distinct blocks in our program. First off, I'll introduce our special guest and share a short video on what UNDP has been attempting to stand up in the face of this pandemic and is doing on the ground across 170 countries for the socioeconomic response to the pandemic, integral to and in close coordination with our UN sister agencies at the service of countries. Second, we will hear from distinguished voices from Togo and India, as well as our sister agencies, the ILO and ITU, on social protection challenges. The ILO, International Labour Organization, and the ITU, the International Telecommunications Union, that is the lead also on the whole digital frontier of our response in the UN, are key partners with which UNDP works every day, globally and at country level. We will also have a live conversation with Professor Guy Standing on a topic that has captured the world's attention and with growing interest concerning basic incomes, and which invites us to think of extraordinary measures during extraordinary times. Third, we'll wrap up with a call for action and outline the next steps. Just a few more housekeeping issues before we start. These are virtual conferencing times, so we join from many different platforms. To my fellow panelists, please unmute your microphone when speaking and kindly keep it muted during other presentations. And again, the reminder, when you see your picture to all participants, if it does not have a little red microphone with a line through it, you are live and can be heard. To everyone watching, there is a question and answer box you can send your comments to in real time. Our team of experts are standing by to answer questions, and they will also share questions with panelists. Our hashtag, #HalfTheWorld, one word, is one that I hope you will also be able to use on social media. And you can also watch the event on UNDP's YouTube channel, www.youtube.com/UNDP. So it is with great pleasure and a little bit of anticipation, because a few minutes ago, she was not yet online, that I hope to introduce our first guest, who in Africa and well beyond Africa really needs no introduction in the entertainment industry. Her name is Ms. Yemi Alade. Yemi is not only a Nigerian artist and singer and famous for her great African hit Johnny, she's on a mission and has joined us also to positively brand Africa to the world, showing its potential and the power of youth. Yemi, it is my pleasure to have you here with us today. And with fingers crossed, the floor is yours and the world is listening. Over to you.
Thank you, Akim. I hope I pronounced your name properly.
Perfect.
Fantastic. Good morning and good afternoon to everyone. It's a pleasure to join you here today from Lagos. Personally, I've been at home, and even though I'm home, I have been working mostly online. But I waste no time to always remind everyone around myself to always do the necessary things, which is wash your hands with running water and soap, use your hand sanitizer, wear your face mask if you must go out. And I think so far, even though the numbers are still, going up, I think knowledge is power at this point in time. Anyways, we are here to talk about half of the world. and the half that wakes up every morning to go to work, despite and because of the global pandemic. It's about the young woman who wakes up before the sun rises to prepare food for her siblings. She heads out the door at dawn to try to earn enough money so that she can feed her family again tomorrow. This is the woman that literally just about feeds hand to mouth, you can put it that way. She's also very self-employed, obviously, buying and selling goods, risking her health for an income that will barely make ends meet. She's not only exposed to the coronavirus, but also to a socio-economic crisis like no other. Yes, the COVID-19 pandemic affects us all, but this young woman exemplifies several billion of the world's poorest, most vulnerable people, who will suffer the most during and after the crisis. How do we flatten the curve to stop the spread, the rapid spread of the pandemic? How do we tackle the socio-economic crisis left in its wake? And how do we actually come out of this stronger? Despite the unprecedented challenges and turmoil created by COVID-19, action is being taken around the world. Governments are expanding the social programs and using digital technologies to reach those who are out of reach. Communities are providing services to those in need and empowering the vulnerable and defending the rights of people to speak and think freely. And individuals are taking selfless actions on the front lines of overcrowded hospitals, providing care, securing the food supplies, and bare essentials of societies threatened by this unprecedented crisis. It has taken a global pandemic to realize how costly it is for millions of people to live without access to health care. With little or no paid systems of care, insufficient protection against gender-based violence, and spotty access to social protection when it is most needed. Each of these make up the many faces of social protection. I hope you will be inspired by the examples of action you will hear about in the next few minutes, from massive registration efforts in Togo to reaching the most vulnerable in Sudan, to the empowering work of women's organizations in India. Join us in making a call for action. Let's not let billions of the world's poorest, most vulnerable people fall through the cracks in our society. Let's pull together as one world on this. Social protection for all is within our reach. It is now my pleasure to invite you all to watch a short video on UNDP's work. Our government and partners on the COVID-19 response around the world.
This is the first ever coronavirus pandemic in the world.
This morning, there are almost 43,000 new coronavirus cases.
The Anambra State government has ordered all schools in the state to vacate immediately.
Global stock markets have plunged over fears about the coronavirus.
COVID-19 is menacing the whole of humanity, and so the whole of humanity must fight back.
Yemi, thank you so very much for your comments, your words, and also to the fact that, as you said, you are trying to inspire people. You have done so for millions and millions of people with your music, and you continue to do so by joining us and many in your country and across the continent in trying to create the confidence, but also the clarity of thinking about how to deal with this pandemic.
Thank you.
I know that this is the second time that we try to, in a sense, do something together, and we had to resort to video connections. But you know, this is perhaps one way in which the new world is unfolding. And please stay with us as we move on. And I'm very proud to introduce now Her Excellency, the Minister of Postal Affairs and Digital Economy. I love this title, Minister Lawson, because it really spans 100 years of technology development and communication. But dear colleagues, we have recently heard how the Togolese government introduced the Novisi, an emergency coronavirus digital cash transfer program, which is expected to benefit 13% of Togo's population, over 1.1 million people, with 65% of the beneficiaries being women. Without any further delay, Minister Lawson, over to you and a recount of the extraordinary journey that you have taken in just a couple of months and what lies ahead in terms of the implications for how we all need to think about social protection. Over to you.
Thank you very much, Hakim. Hi, everyone. It's my pleasure and a great honor to be to have the opportunity to talk about what we did in Togo to assist the poorest of the Togolese during these trying times. So a small recap: when we the first COVID case was reported on March 6th, and a month after, the president made a speech where he declared a state of national emergency, health emergency. And we pretty much knew what we had to do, because the whole world was facing the same situation, which was social distancing. We set some very clear rules. We closed the schools, the churches. The capital city was the main main city which was hit by the virus, and so we put a curfew. And during that time, internally, the president was saying we need to make sure this disease does not spread, but we need to make sure that while doing so, we could still protect the poorest, because we knew that the informal sector was going to be the one which was going to suffer the most from the physical distancing measures that we had to take. So a week after his initial speech, which is he spoke to the people on on April 1st, and on the 8th of April, we launched the Novisi program, which is a cash transfer program designed to transfer cash to those who would be affected by our physical distancing measures, namely the population in the capital city, Lomé, and the informal sector. And so this program was very quick to execute, because it took us maybe 10 days to set up a platform. And the challenge was that we needed to set up this platform while respecting physical distancing measures. We wanted to transfer cash to a lot of people, to the population, and we needed them to register to the program, but we wanted to make sure that there would not be any point of registration. So from onboarding to receiving the cash, we set up a program which would be entirely digital. And it's a program where we ended up registering 1.3 or 1.379 million people, which is approximately 35% of all the adult population of Togo. And we were able to support 567,000 people, which is 15% of the adult population in Togo. and out of which 65% were women. We spent approximately $20 million. And so what is Novici? Novici is a program designed to support the informal sector, and by giving them, distributing cash, which was equivalent to 1/3 of the minimum wage. And the program was also designed to make sure that women would get more than men, because the goal of the program was to support households. And in our thinking, in order to better support households, it was important to give a little bit more to women than men. And so we used, for onboarding, for registration, we used voters' ID, because we wanted to make sure that the money that would be spent would go to the beneficiaries. So we needed to uniquely identify these beneficiaries. And luckily enough, we had presidential elections at the end of February. So we had a biometric database of an up-to-date biometric database that proved very handy in registering people and in distributing the cash afterwards. So it also was innovative, because we wanted people to voluntarily enroll into the program. We wanted them to say, okay, I need help, and these are the steps that I take to get help, instead of just us sending money randomly. It was very important that people took responsibility and in acknowledging a particular situation. And so the decision of who would get the cash, who would get funding and who wouldn't, was based on geographic locations, because remember, the capital city, Lomé, was the one which was hit the most by the COVID virus, and it's in Lomé that we imposed the curfews and closed down the stores and the restaurants and the bars and everything. And so it was based on the geographic location. It's also based on the occupation of the beneficiaries. To be eligible to receive cash, you needed to be from the informal sector. So typically, if you were employed in the formal sector, you wouldn't get the payout. And so the payout was $20 per month for women and $18 for men. And so, and we also acknowledged that because we were assisting the poorest of the population, it was important to use a platform that would be that could be used without having a smartphone or 3G. So it was a USSD platform. And so the program was extremely successful, and we learned a lot from it. For us, it constitutes the basis now, thinking of social protection. In Togo, we have a methodology. This is the Novici methodology, where it's entirely digital, it's all traceable, it's entirely transparent. So I think that in Togo, from now on, social protection and the use of digital to distribute money is equivalent to being transparent. It's also, it means being transparent. It also means that we have now the data in real time. Throughout the program, every day, we would send out the numbers, the data on beneficiaries, professions, and amount spent, and etc. So it was also a first, because I think that Togo has never had prior to that experience such a level of transparency and giving information in real time. And we think that people appreciate it very much. So it also changed the perception.
Sorry, I'm running. Can I, because it is an extraordinary story that you're telling, and one that, as you say, was unthinkable probably just 4 or 5 months ago. Just in 1 or 2 sentences, if I could ask you, if you look forward to the next 3 months, what is your biggest headache, or what would you like to solve if you had a magic wand? Because often designing these programs is one thing, seeing them play out is another, and yet you have already walked such a long distance. What is there, as you look ahead, that is singularly important to the success of such a program? if you could do it maybe in a couple of sentences, because we then have to move on to Reema Nanavaty.
So number one, it's implementing biometric ID for the population. It's a project that we received funding. We received funding from the World Bank to do, so we're going to do so. The other thing is that because now we changed methodology, we want to increase our social protection programs, but we want all our social protection programs to be digitalized. So moving ahead, looking forward, we need to convert all these existing programs to find ways to digitize them so that we can increase transparency, etc. The other thing is that's my last point, is that with all these digital projects, we gathered a lot of intelligence. So it's looking forward, it's the use of big data to better understand our constituents and how we can actually help them better. So I think these are the things that we're looking to improve within the next few
Thank you.
months.
Thank you so much, Minister. And I can tell you, I have been following you from the first weeks when you set up this program, because I could not believe that this is possible. And I think you have rightly a reason to be proud of. And I think we have learned as UNDP, and I think many others, that extraordinary things become possible. And you just spoke to the digital ID dimension, for example. Before I turn to Reema in a moment, we have in fact invited my dear colleague Hulin Zhao, who leads the International Telecommunication Union, who is at the forefront of the whole broadband connectivity challenge worldwide in the United Nations family, to share a few thoughts with us on precisely that topic that you just alluded to. So Minister, please stay online, and we will listen to Hulin Zhao now, and then I'll come to Reema.
Thank you.
Thank you. Colleagues, can we play the video, please? Video clip from our ITU Secretary General.
As the UN Agency for Digital Technologies, ITU's work is all about bringing the transformational power of digital to everyone, everywhere. In just a few short months, COVID-19 has dramatically changed our world. It has changed the way we work, the way we learn, the way we collaborate and connect with each other, and the way we interact with the world around us. But amid all these changes, one message has become very clear. Broadband connectivity is no longer just nice to have. It is a must-have. It is the vital lifeline that keeps us connected, and it will be the essential foundation of economic recovery and future prosperity. In the wake of this crisis, no one now underestimates the power of digital. And yet, today, almost half of the world's population is still not connected to the internet. The COVID pandemic has served as a wake-up call to the global community to renew efforts to connect the 3.6 billion still offline as a matter of utmost urgency. We need not just to build back better, but to build back better with broadband. So, when we have finally put this pandemic behind us, I urge global leaders to focus hard on connecting the unconnected. We need to prioritize the 4 I's: infrastructure, investment, innovation, and inclusiveness, and get broadband network in place everywhere. Multi-stakeholder partnership will be key, and we look forward to continuing our very positive collaboration with the UNDP through the Broadband Commission and through joint initiatives as well as with other UN agencies, private sector partners, and civil society. Together, we really can change the world. If we are truly to leave no one behind, the power of broadband must be put in reach of all.
Thank you very much to my colleague Hulin Zhao for joining us today. And I move straight to Reema. So Reema, if one is not a minister like Minister Lawson, then the next most powerful position, I would argue, could be to be the Director General of SEWA, the Self-Employed Women's Association in India, and with a track record that is second to none in addressing both women's concerns, and particularly also with a focus on the informal sector. And to many in the world, this crisis was an eye-opener when they realized that in many developing countries, 60, 70, 80, sometimes more % of people earn their livelihoods in the informal sector. A lockdown from one day to the next can literally mean no income, no social safety net, nothing to fall back on except the community, the family. You work in the midst of this, and SEWA is a trade union established in 1972 with currently more than 17 million members across 18 Indian states. You work on the ground with informal workers in rural areas, domestic workers, small vendors, construction workers, waste collectors in urban areas. Ms. Nanavaty, it is my pleasure to have you with us today in this panel. And I would welcome your perspectives on both how this pandemic and the lockdown is in fact impacting women in the informal economy, and also some examples from SEWA's work of how you, just like all of us, have been challenged to stand up responses in a matter of days and weeks to reach millions of people. It's a great pleasure to welcome you. You have the floor. Thank you.
Thank you so much, Dr. Akin Steiner and Dr. Guy Standing and Minister Lawson as well. And as you rightly said, in our country, India, 93% of the workforce is in the informal sector. And therefore, we call it as the mainstream because it's only 7% of the workforce which is in the formal sector. So today I represent and will share what has been the reality of the members of SEWA, some 1.9 million members. And for all these informal sector women workers, the current pandemic and the lockdown is directly and in a very disruptive way affecting their work and income. An internal survey that was conducted by SEWA post-lockdown showed that over 40% of the informal households have completely lost all of their livelihoods. Over 43% have been forced to reduce their food intake, and 73% will need food-grade support to sustain themselves if the current situation extends further, including the migrant workers now. The plight of the children is even more pitiable. They had just begun going to school and are now facing a setback for at least a year. And in many cases, we see dropout of the school children, especially of the daughters, is high. In 25% of the households, women and girls face abuse and violence from the men. Whatever assets that they have in terms of land, working capital are also lost or have become redundant. And therefore, you can see that how important is universal social protection to sustain post-COVID rebuilding and reconstruction. The economy and the cities have been very unfair to the urban informal sector workers, may they be the migrant workers or the informal sector workers. The migrant workers had to rush back to their homes as if the city was not their home for safety and protection, including social protection. The above two, the migrant workers and the informal sector workers, especially the women workers, are the overwhelming majority of the urban workforce. The above two's contribution to economic growth is far more than the industrial sector. And this is odd because those who run and expand our cities and economy are left without any protection and preparedness. In spite of such suffering, women are willing to take on new challenges eagerly, without expecting anything from the society, business, or the government. We call them as the human capital, as UNDP focuses on human development. They are not the liability, but a huge potential to rebuild the nation's economy. Let me give you some examples of what we have been experiencing. The vendors in the cities play a very major and an important role. And during the lockdown, when the street vending was completely banned, these vegetable vendors started using electric rickshaws and delivering vegetables, fruits, and other essential items at the doorstep. SEWA then linked these vegetable vendors with the vegetable growers from the rural areas in the villages. And now this has turned into a whole social enterprise connecting the rural vegetable growers, the small farmers, the family farmers with the vegetable vendors in the cities. Altogether, 45,000 vendors and vegetable growers are now setting up their e-enterprise, building their own digital platform, bringing more dignified and decent work. Similarly, the waste recyclers, the landless laborers, were trained into making bakery, confectionery items, bringing back the traditional coarse grains into consumption. They moved from the villages and stayed at the production and training center now for the 4th month successively, and they produce fresh bakery items and sell online to the customers in the cities. Each woman is now earning close to about $50 a day. So these are some of, similarly, the agribusiness initiative, which has a rural distribution network, is connecting 25,000 small farmers directly to the rural households, ensuring food security to the households. The cadre of sales women, we call them as the Rudy Bands, has now a monthly sales of over ₹2 crores. These are just a few examples. Our grassroots leaders, whom I call as the human capital, have adapted to online and digital and virtual trainings, education, awareness. They use telemedicine to address their health-related issues. They work as banking correspondents, ensuring that the bank transfers, the cash transfers that are happening are accessible to the women and their households as well. They also run education and awareness for children. So last but not the least, as UNDP's mandate is human development, so let us not have the informal sector workers or migrant workers considered as commodity, but let us see them as human capital. How this capital has to be nurtured and create a shared prosperity, rather than this human capital, the informal sector workers, be exploited to generate profits by the formal sector. I urge UNDP to invest in building resilience of the informal sector, especially the women workers, by building a livelihood recovery fund. And this will build resilience not only of the informal sector workers, but also of their social enterprises. I think what is really important is to adopt a rapid unrolling of universal social protection and preparedness programs for the informal sector workers in India. The first pilot can be of the urban informal sector workers. However, our experience has shown that universal social protection is not possible without universal basic income. And basic income is not possible without basic livelihood support. Therefore, our second demand is for large-scale investment in livelihood funds, especially livelihood recovery funds for women workers. Thank you so much.
Reema, thank you very much, first of all, for very clearly identifying the challenge, but also speaking to some very concrete examples and ending on an outlook that I think is the perfect introduction for our next speaker, which is this question of, this is not just social safety nets we're talking about here. And perhaps the irony of this pandemic, if one can call it that, is that in trying to address the health crisis, we are creating the social and economic crisis. In trying to find a way in which we can address that loss of livelihood, that loss of income, we exponentially increase the capacity to contain the pandemic. So the two are so inextricably linked. And that is why I believe we are increasingly seeing, not only in the rapid emergency responses, but also in the policy considerations, a growing realization that an idea that perhaps to some a few years ago seemed to be beyond reach or not viable is becoming more and more part of our reflection on inequality and also on the response that we often refer to as building back better, as I would like to call it, building forward better beyond this pandemic. Our next speaker, Professor Guy Standing at SEWA, at the School of Oriental and African Studies at the University of London, is the co-founder of the Basic Income Earth Network. BIEN, as it is called, is a network of 96 basic income movements across the world. And Professor Standing, following on where Reema has just spoken, and also the scalability of SEWA's programs, clearly indicates that not only is there a capacity to rapidly stand up unprecedented initiatives in terms of reaching people, but there is also a growing realization that in comparison to some of the other measures that are being taken in the economy, perhaps these temporary or universal basic income options are not at all beyond reach and may prove to be central to at least a response in many parts of the world. In your academic work and the work that you undertake with the Basic Income Earth Network, you have touched on this. So I would like to invite you to share with us why you are so convinced that a basic income is needed to address some of the devastating impacts of the current pandemic and also emerging recession, but also with the perspective on the longer term. Over to you. Thank you very much for joining us.
Well, thank you very much. And first of all, I'd like to congratulate Minister Lawson and Togo for taking the initiative that they've taken, and very much hope that they can draw on our pilots of basic income transfers in Africa and India. And also like to acknowledge with Reema, nice to renew our contact, as it were, that I've been working with SEWA on this subject for over 20 years. So I'm beginning to date myself. I think it's very interesting that last week, Massive Attack put out a video. They'd asked me to give a speech for that video. So I'm now on a song on why we need a basic income. And extraordinarily, in the 3 days since it was put out, over 114,000 people have viewed it. And I feel that at least half of those have written to me or sent me comments. And this is a global thing because suddenly people are saying, why not? We cannot afford not to have a basic income. To make it clear what a basic income is, it would mean that every individual, man and woman, would be paid an equal, modest cash transfer each month without conditions, without means tests, and a smaller amount be paid to children, paid to the mother or surrogate mother. And that is what we've done in our pilots in Africa and in India with SEWA. And I think the fundamental reason for wanting a basic income system, because you're going to have supplements for people with disabilities and so on, so it's not equal everything, is ethical. It's a matter of common justice. It is a matter of freedom. It is a matter of giving everybody basic security, which is a basic human need and a public good. And that, I think, is fundamental. And what we have to realize at this moment, and UNDP is uniquely well placed to understand this and articulate this, is that this is a fundamentally an economic crisis in which the pandemic was the trigger, which has led to a huge economic crash. And what I've basically said is that using William Beveridge's analysis of 1942, that today we are confronted with 8 giants blocking a sustainable, good economic system. The 8 giants are inequality, insecurity, debt, stress, huge amounts of stress, precarity, a loss of rights, the automation and technological changes taking place, the threat of extinction, and the rise of neo-fascist populism led by a plutocracy. And what we've got to understand is the income distribution system of the 20th century has broken down. And we have a system of global rentier capitalism where we need a new income distribution system. And then I think is a fundamental reason why we need a basic income as a core. It's not a panacea, but it provides a core, a base. And why it must be universal and not targeted and means tested is the following reason. What we're learning in this pandemic is the resilience of all of us depends on the most vulnerable having resilience. And we are all vulnerable. That is why we need to have a quasi-universal system of basic income. And what we found with our pilots in India and in Africa and in Canada and various other places is that if people have basic income, their mental and physical health improve. Their ability to get their children learning in school improves. Their productive work improves, does not go down. Their sense of worth and solidarity, the great feeling of Ubuntu in Africa, the sense of compassion for others improves. And it is something that is desirable now as an emergency measure. I believe that once it's introduced, there will be a domino effect in which people will say, why on earth have we not had this for many years before? And we're going to have future pandemics. We're going to have second waves of this pandemics. And unless we build a system of resilience, that vulnerability is going to continue to dog us. I believe it's possible. I believe now there is a momentum out there. And that momentum means that it's up to the precariat, it's up to all of us to be courageous enough to demand we have a basic income system.
Professor Standing, thank you very much for clarity, but also for, in a sense, embedding this in the reality that we are witnessing across the world. And I have one follow-up question to you, but just to perhaps say, to me, this is also reminiscent to some of the debates we had in the 19th century in the industrialized world, in the industrializing Europe, where the emergence of a social welfare system, a social safety net, social protection mechanisms were also considered to be unfundable, not manageable, and therefore not implementable. And yet social cohesion, the sense of ethics and a commitment to greater equity ultimately led to many of these innovations actually being implemented and economies thriving rather than collapsing. So could I just ask you, if you were to pick the three main arguments that give people a policy nightmare when they hear about universal basic income schemes, what would you say are they? Are they administrative? Are they macroeconomic? Are they incentive related? What have you encountered and how would you respond to them? Because clearly the debate has reached a point where I think we have an epochal moment, and the pandemic has simply put the spotlight on something that has begun to tear our societies apart. Inequality in the 21st century is something that last year in the Human Development Report we very much focused on. And I think much of the discussion we're having here this morning is not just a response to the pandemic or relevant to it, but indeed into how we view the future of development and development policy making moving forward. But to you, what would be perhaps 2 or 3 examples of those classic orthodox reflex arguments that you have encountered, and how would you respond to them? Back to you for perhaps another minute or so. Thank you.
Well, first of all, the argument is made that it's not affordable. And I disagree with that fundamentally. The governments of the world are spending billions and billions of dollars on propping up their system. And we've seen that most governments in most countries spend about 5–6%, sometimes more, on subsidies that go predominantly to the wealthy and big corporate capital, if you like. It's a matter of priorities. And I think this debate that we're having is changing people's priorities. And that I think is healthy. And it is affordable. I've explained that in various ways. There are various ways of funding it. I would urge the UNDP to continue the support they have been giving to piloting, to seeing how they can best be implemented, what additional measures are needed to make the administration easier. But I think with mobile money now and with smart cards and things, the technology of reaching people is no longer a big impediment that people say. And finally, I think the prejudice of some people, middle-class people in many countries, we shouldn't give something for nothing, that argument, while at the same time they defend vast inherited wealth. That is pure hypocrisy. And I think giving something to everybody is going to induce much greater social solidarity and real development that the UNDP has always been standing for, and the other UN organizations have been standing for. We must be brave enough to confront the skeptics, the cynics, because we've seen with our pilots, if you give people basic income security, they improve their lives. They improve their health. They improve the health of their children. That's what they want to do. And citing just a few people who are not doing that as if that is the norm is ridiculous. It's much better to presume that human nature is decent and wants to improve society and lives and build a system that respects dignity. And I think the arguments against it, and I've identified them in various publications, I think those are fading away and somehow looking vaguely ridiculous right now, because we need a resilience that organizations like SEWA have been standing for many, many years, and it's always been a great source of pride that I've worked with them, to provide that dignity in which we can build a better society. That is what it should be all about. And let's get down to the nitty-gritty, just as that Togo example has given delightfully, and I hope that they resolve those problems, and please consult Bien, because we have a lot of experience of implementation. So I'm vaguely optimistic. And those 114,000 people who have been watching the video seem to be optimistic too. And that I feel purring like a cat.
Thank you so much, Guy. And I think sometimes it is reality that shapes also public understanding. I think the visibility of the cracks in our national economies and our social protection systems have become so obvious. And this is something that I think, first of all, we embrace as a responsibility and as a duty also as the United Nations Development Programme and indeed the UN family in this socioeconomic response right now, to put a spotlight on the indefensible, the invisible, and ultimately not justifiable. And I think that is both a responsibility, but also an opportunity. And thank you so much for giving us the courage to not only look at the problem, but actually recognize that there are solutions. And I think together with Minister Lawson and Reema and yourself, you have made a fantastic panel this morning that actually has looked at it from 3 vantage points, and yet they are convergent, and they are convergent in a reality that I think societies, and you spoke to the video just now, are echoing every day. I want to turn briefly to my colleague Guy Ryder, who leads the International Labour Organization that recently had its 100th anniversary. And while his focus is obviously on those who have employment, his lens and that of the organization extends also to those who work in the informal sector. And the ILO has been at the forefront for years in arguing and calling for social protection floors and trying to address this vulnerability that you referred to just now, Guy, and that also Reema spoke to, and Minister Lawson. We have to find ways in which we can address this, and it is my great pleasure to invite Guy to briefly share his comments with us. Thank you very much, and colleagues, over to you.
Distinguished delegates, I'd like to thank UNDP and Achim Steiner for organising this event and inviting me to share some views on social protection with you. And I'm particularly pleased to do so because UNDP and ILO share a common view of the critical importance of social protection, and we are working together to make good the enormous gaps that COVID-19 pandemic has so cruelly highlighted, that most people in the world do not have access to social protection, and only a small minority enjoy anything approaching comprehensive protection. And if the pandemic has sent the world one message, it is that we are only as safe as the most vulnerable amongst us. And acting on that realization, all over the world, countries have mobilized impressively to respond to the crisis. According to the latest update of the ILO Social Protection Monitor, more than 1,200 social protection measures have been adopted across the world. And so we've seen initiatives for rapid access to urgently needed healthcare and income security through sickness benefits, unemployment benefits, and social assistance, contributing also to job protection. And the drama of the pandemic has brought with it the widely expressed commitment to build back better. If we're serious about that, then it must start with the unfinished business of social protection for all, of freeing all people from fear. But the COVID-19 crisis has also widened the gaps in social protection financing. Developed countries with greater financial capacities have responded by making much needed investments in their own social protection systems. And these same countries have also made international commitments under the 2030 Agenda for Sustainable Development to help developing countries invest in their social protection systems to weather the crisis and to build back better, build back stronger. Just last week, during the ILO's Global Summit on COVID-19 and the World of Work, we heard how countries are responding to pandemic with whatever means available to protect their people's health and their livelihoods. Equally, we heard calls for urgent, concrete and coordinated steps to ensure that all countries have the financial space and the flexibility that they need to achieve a sustainable recovery. And the ongoing deliberations on financing for development in the era of COVID-19 and beyond, under the aegis of UN Deputy Secretary General, will be crucial to ensuring a global response that is at once fair, equitable, and based on the value of solidarity that we all share. So I wish you the very best in your discussions.
Thank you very much to my colleague Guy Ryder, and I just want to emphasize that in our UN development system, which includes many agencies, funds and programs, our partnership with the ILO is precisely to what Professor Standing and our other panelists spoke to, which is to join forces in order to be able to bring the best of what we can assemble in terms of the understanding and the empirical evidence, but also then reach into the different parts of government. Because in one country, the Minister of Labor may have a very different view and knowledge horizon than the Minister of Finance. And it is precisely here that we see ourselves as the UN's development program as being an integrator, very much bringing these different perspectives together. In concluding, let me briefly, because we have already overrun our time, thank our distinguished guests and panelists, both for their thought-provoking and action-inspiring discussion. We covered country examples on how social protection happens in the real world, how bold proposals are coming to the fore under exceptional circumstances, and how the UN system also and UNDP itself must pull together for a comprehensive socioeconomic response, forward-looking, bold and challenging. So today we are calling on our development partners across the world to step up on social protection. We know how difficult policy, programmatic, fiscal and financial repurposing is. We are witness to it every day across 170 countries. However, what we have also seen is how countries, the UN system, the international financial institutions, and also bilateral donors have begun to pull together in record time since March. The collective response is yet inadequate and wanting in terms of scale, but certainly our ability to engage together on the ground is without precedent. We still believe that there is currently a lack of attention on social protection because the macroeconomic lens dominates. So spending $1 billion on saving some core industries in a country that maybe employ 20, 30,000 people still is the most visible part of a response, while saving 1 million people's livelihoods for a fraction of the cost is not on the equation. This is why we put so much attention today on this question of social protection and moving beyond that with a perspective also of cash transfers of temporary basic incomes, and ultimately a question of, is a universal basic income one of the ways forward beyond this crisis? We know that integrated action is hard work, politically, economically, institutionally, but as an institution at the center of the development arena, we pledge to work with you on the socioeconomic response beyond recovery towards 2030 with the SDGs as a compass. And that is why just a few days ago, we identified 4 key areas in which we believe UNDP can significantly contribute to accelerating the pace of discussion. They cover governance and agency. People are not just beneficiaries. They must be agents of the choices that are made in their name and on the future of development pathways. Secondly, on social protection, from both tackling inequality, trying to understand how to reach those who don't feature in the national statistics, and to put mitigation programs in place that may have a future well beyond the pandemic. Thirdly, the green economy. The opportunities and the imperative converge in a build forward, back, better perspective. And finally, digital innovation and disruption. We have heard examples today. It is one of the great accelerators and potential enablers of innovation, and we are very focused on helping countries to move forward with this. We are calling on government partners to step up on social protection. These extraordinary times require extraordinary measures that run the full gamut of social protection initiatives, from reaching the most vulnerable with geo-referenced registry systems, to expanding digital payment systems, to setting up care systems, to fighting gender-based violence, or topping up to rolling out temporary basic incomes to meet the challenges at hand. And we are reiterating our commitment as the United Nations Development Programme to stepping up on social protection. Despite the disruptive nature of this crisis, I have seen the very best from our partners, our teams across the world in the past few months, helping people and countries cope, prepare, respond, and hopefully recover in the face of COVID-19. UNDP, as the technical lead of the UN's socioeconomic response, makes us also doubly committed to helping decision makers look beyond recovery towards 2030, to make choices and manage complexity and uncertainty, because the choices made today, if made well, could be the tipping points that transform our societies and our planet for the better. To our distinguished panelists, to Yemi Alade, to Minister Lawson, to Reema and Nanavaty, and to Professor Guy Standing, thank you so much for joining us this morning. It is a glimpse of the reality we face. It is also a horizon that we have touched on today on how we move forward. I thank you for your work that you do every day. I thank you for joining us. I thank all the participants who have been part of this morning's session. And I can tell you on the question and answers in chat room, a lot is going on. Our colleagues are responding to these questions, hopefully providing some answers. Above all, creating a network of innovation, a network of courage, and a network of realistic commitment. With these remarks, thank you from me, Achim Steiner, the Administrator of the United Nations Development Programme.